Good afternoon, everyone. Thank you for tuning into today's webinar on resources, tools, and supports for older adults and individuals with disabilities. It is 1 o'clock sharp now, and we do have a lot to cover in the next half hour, so we are going to get started on time to be respectful of everyone's time and end on time as well. This is the 5th webinar in our summer webinar series. And yes, it is still summer. Just because my kids are back in school does not mean summer is over. My name is Alana Krober, and I am the Director of Information Services here at United Way of Connecticut 211. Before we dive into content today, a few housekeeping notes. Number one, participants' audio is muted throughout the entirety of the webinar. However, you can use the Q&A box in your webinar controls to chat in questions. I hope to have a couple of minutes at the end to answer them, but if not, we will provide written answers to all questions that are submitted in a follow-up email that will go out. Also, the PowerPoint and the webinar recording will be emailed to all registrants in the next couple of days, and the recording will also be posted on our 211 CT website in the next couple of days as well. Okay. So let's get started. Here's a quick snapshot of what we'll be covering over the next 30 minutes or so. 30 minutes is not a lot of time to cover a topic as big and meaty as this, but we know people are busy, which is why we are keeping these webinars short. What that means, though, is that we cannot get into too much detail about specific programs and services. The goal today is to give you all a high-level overview of all the ways you can use 211 Connecticut to find help for an older adult or a person with a disability, as well as highlight some of the other great partners and resources and experts that we rely on when serving these populations. Because, as you all know, the service landscape of programs and services for these populations is really complex and really complicated, and to most people just sounds like an alphabet soup. MSP, Medicare D, Husky C, SSI, LIS, MFP, CFC, CHCPE, right? And that's just the beginning. I could go on for a while. So it can be really difficult to navigate that soup. So our goal today is to at least make folks aware of some of the resources and tools that can be good starting places. The state of Connecticut has worked really hard for many years now to create a no wrong door system in Connecticut to help individuals and families find the right services and to streamline and simplify access to long-term services and supports. And we at 211 are grateful to be a partner in this initiative and to support the ongoing work and to be one of those doors, one of those entry points for folks needing help. So this webinar will not be a thorough overview of all the 211 programs, nor is it a comprehensive tutorial on how to use the website. But if you do need that background, definitely check out the recording from our first webinar of this series, which is that really good overview and tutorial. And that's posted on the professionals page of our website, and the link is there. Okay, so I want to spend a minute reviewing the various ways that providers and clients can connect with us. And we understand that sometimes special considerations are needed to ensure that older adults and individuals with disabilities can easily access our services. And so we've been working really hard to continue to expand the methods and channels by which folks can connect with us. So you'll see up at the top there, the traditional way Connecticut residents have connected with us over a 42-year history is by phone. So by dialing the toll-free, easy to remember, 3-digit dialing code, 211, you can reach one of our 211 contact specialists 24 hours a day, 7 days a week, 365 days a year. And calls into 211 are anonymous and private, and it does not have to be the individual in need who calls. In fact, more often, it's a family member or a caregiver who is calling, trying to gather some information and options for a loved one. And this is why I have the out-of-state number listed on this slide as well. You'll see over on the right, it says calling from out of state, 1-800-203-1234. Because often these family members may not even live in Connecticut, right? And yet they are trying to learn about Connecticut programs and services for an older family member who does live here. And the way that 211 works nationally is that if you dial 211 from any phone, you're going to get connected to the local 211 that serves where you're physically located. And so if if we have a family member that lives in Tennessee and they dial 211 from their phone in Tennessee, they're going to get routed to the 211 in Tennessee when they're really looking to connect with us to get help for a family member that lives here in Connecticut. So that's why we want to make sure folks are aware of that 1-800 number as well. That's the number to dial when calling us if you're out of state. When someone calls 211, whether from in-state or out-of-state, the 211 contact specialists here in our call center are going to provide supportive listening. They're going to do a brief assessment, provide relevant referrals, and offer to follow up with the caller in a week or so. Individuals with hearing or speech difficulties often use Relay Connecticut via 711 to connect with us, but they can also use our TTY line, which is also listed on the slide. Individuals can now choose to chat with a 211 contact specialist. This is a great option for those who simply prefer to communicate this way, but also another good option for individuals with hearing or speech difficulties. And lastly, individuals can opt for the self-service approach on our website, 211ct.org, where they can search the website themselves for programs. This, again, is another good option for individuals with hearing or speech impairments. And a couple of other notes about website accessibility. So 211ct.org, our newest version of the site, which we released about 3 years ago, is completely mobile friendly, meaning that it responds and appropriately scales for full use on whatever size device someone is using. So this is important because while many older adults may not have a computer, they may have a tablet or a smartphone. And so the website is scaled for full functionality on any size device, no matter what that device is that a user might be using. We've also worked hard to add better print functionality to the website so that providers who are working with clients who may not have internet access or computer skills can put together lists of resources for their clients and then print out hard copies for those individuals. Also, we have, of course, a link on our site to the Essential Accessibility app so that individuals that need that level of accessibility can get connected to that as well. And we do have a couple of other channels, communication channels that we hope to be bringing online soon. So these include texting. So we're hoping to be able to launch texting in the near future so that individuals can converse with us via two-way text, as well as integration with voice-activated assistants like Alexa. So what that means is that we're hoping to integrate the 211 search with those voice-activated assistants like Alexa so that individuals that may only have, let's say, an Alexa device can speak into the device the information or the resources that they're looking for, and then have the resource and referrals returned to them from the device. So we're really excited about both of those. Okay, so given how many people today are using 211ct.org to search for information and resources, and our web traffic was close to 2 million last fiscal year, I'm going to spend the next chunk of time reviewing the different tools and features of the website that can be helpful. So the 211 database of community resources that our call specialists use to search for programs for callers is also publicly available on our website. And the database contains over 40,000 community resources, including in-home supports and other older adult programs, and is maintained by our team of 6 resource specialists who are updating and changing the database every day, all day. We have resources in the database that are relevant to older adults across the entire continuum of care. And one way to search for resources on the website is the keyword search, and that's the image you see at the top of this slide where it says, I'm looking for, and then there's a blank. This is really prominent on our homepage, and it's where you can type in the service that you are looking for, or you can type in an agency or program name, as well as a location. You can then quickly and easily filter your search results based on radius, age, gender, target population, or day of the week. And the keyword search is really great for individuals who know what they're looking for, and hopefully you'll feel better equipped to use this after the webinar. But it isn't always the case that a help seeker knows what is available or what to type in a search box. So many of our callers know they have a loved one who needs help, but they don't know where to begin. So for those individuals, we recommend option number 2 and option number 3 listed on this slide. So option number 2 are common language help statements that I'll show you in a moment, that are also on the homepage. And these are statements like the one you see to the right that says, I need transportation. And so sometimes that's a better starting place for individuals. And then we also have category pages related to specific topics or populations. And you can see we have one for older adults, which is also a really good starting place for folks who don't know what to search or where to begin. And I'll show you both of those in a minute in the live demonstration of the website. Another good place to start is our e-library or our electronic library. We have approximately 400 white papers in our e-library that provide brief overviews on topics and programs. You can search the e-library by keyword or by category. And if you can see on the slide, the screenshot there, there's an entire category of papers related to older adults, as well as disability-related services, which includes papers on topics such as transportation options for individuals with disabilities, Medicare savings programs, kinship caregiver options, dying without a will, all sorts of relevant topics. And of course, we recommend that you sign up for a free My 211 account to help you pull together and save all the resources that you find on the website. There are 2 other important tools on the 211 website that we also want to highlight. The 211 Navigator, which is our online benefit screener. This is a tool that takes less than 2 minutes to complete. It's anonymous. An individual can complete it for themselves, or a provider, social worker, case manager can complete it on behalf of a client. You provide some basic information about the individual in need, and then the 211 Navigator screens that person for 23 state and federal benefit programs. So it's not an eligibility determination, but it does give somebody a sense of what they might be eligible for and whether it's worth their time to pursue an application process. And then also the 211 events calendar, which lists events happening across the state that are being hosted by agencies listed in the 211 database, so long as the events are free and open to the public. And many of those events are relevant to older adults and individuals with disabilities. So I did want to draw your attention to that feature on the website as well. Okay, so kind of moving on to some more of the specifics about what resources in particular are in the 211 database of community resources. And so there will be a lot of words on these next 2 slides, which we don't always do in presentations, but because this webinar is so brief and we want to leave you with a document that can be a helpful quick guide, we want to use these 2 slides to provide a fairly comprehensive snapshot of the types of services we have listed in the database. So in each bucket listed here, there are the primary services we have listed in the database in that particular category. So this does not list all of the services in the database, but it gives you an idea of some of the key ones. Also, in some of the buckets, you will see the count of how many programs we have in the database in parentheses next to the service type. So in this first bucket here, this assessment, screening, and navigation are some of the most important resources to help folks at the beginning of their journey. So these are resources that help to assess somebody's level of need, as well as those critical supports to helping individuals themselves, as well as family members and loved ones, navigate that crazy alphabet soup that we talked about a moment ago. This next bucket, let me go back one. This next bucket down here, the home care, in-home supports and day programs, is particularly important to one of the primary goals of the No Wrong Door initiative, which is to provide people the supports they need to continue to live in their homes independently in the community. So these are resources like in-home assistance, home-delivered meals, home barrier evaluation and removal services, right? So things that can be really critical to making sure that individuals are able to stay where they're at, stay in the community in their homes, and not, move into residential care or higher level of care. And then this third bucket over here on the right of housing and residential care options also reflects what we hear as a huge need from our callers, right? So basic subsidized housing as well as residential care. And the results, you'll see here that some of the result sets for these particular services are best when filtered to view options that are specific to these populations. So in particular, the low income and subsidized private rental housing, as well as public housing, are huge categories of resources in the 2-in-1 database. And so to get a much more targeted result set for either older adults or individuals with disabilities, both of those searches can be filtered. So we just wanted to draw your attention to that. Okay. And then, of course, assessing for an individual's level of care and finding programs to deliver that care is only half the battle, right? The other complicated piece of the puzzle for many is figuring out payment options and, related to that, an individual's overall financial health, especially when on a fixed income. And so this bucket here, the payment and income programs and financial assistance, again, gives sort of a smattering of some of the programs that we have in the database that provide payment options as well as financial assistance. Some things that are more obvious, and then some that sometimes people aren't aware of or forget about, like rent rebate and property tax rebate programs, as well as free tax preparation. And then these other 2 buckets list important transportation services and other particularly relevant programs. So you'll see that under other needs and supports, I have adult protective services starred, just to kind of flag that one or highlight that one to indicate that 2-in-1 does play sort of an extra role in the service delivery there, because we do cover the phone lines after hours for protective services for the elderly. And lastly, I wanted to point out that there is another way to search the database, which is by target population or health condition. So this is a little bit different in that instead of searching for the particular service that you're looking for, like congregate meals or volunteer opportunities, to find programs that are categorized as being specific to veterans or older adults, kinship caregivers, or a health condition. And these are just some examples. This is not an all-inclusive list. Alzheimer's disease, Parkinson's, cancer, you could search those terms as well and get a list of a variety of resources that are targeted to those populations or conditions. Also, the terms on these two slides are the exact terms that we use to categorize services in the database. So searching these terms will yield the best results, but you don't have to use these terms. You can search whatever word or short phrase you want, as the search engine is designed to accommodate common language searching. So for example, you don't have to search adult day programs. You could search daycare for elderly and get the same results. So that's really important to know that, yes, these are the exact terms and we want you to know what those terms are, but that the search engine and the website can handle, variations of those terms as well as common language searching. Okay. So let's go to the website now and take a quick look at some of the tools and do one sample search. Okay, so this is the homepage for 211ct.org. Just wanted to point out a couple of those features I mentioned earlier. So if you scroll down the page, here's the link to the community events calendar. And further down, here's a link to the 211 Navigator, both of which we just spoke about. And up here, you'll see the chat option, the translation option to translate the website, as well as the link here to access your My211 account if you have signed up for a free My211 account. And then here's the link to the e-library that I also mentioned. And like I said, you can search the e-library by keyword here or by category. So if we select the older adult programs category, you'll see the list of white papers that we have in this category. One that I'll highlight for a moment is the Kinship Caregivers Grandparents Raising Grandchildren paper. I point this one out because it's one of the most popular papers in the entire e-library. Consistently gets close to 4,000 views a month. And you can see this is a little bit of a longer paper, but provides some really good information for kinship caregivers. And then you can make a PDF of the paper right here to save it or print it. Okay, so I'm just going to go back to the home page. And we'll do very quickly here, this unsure of what you're looking for, let us help is where you find those help statements we talked about. And then to find the category page for older adults, you'll click on more categories. And then scroll down a bit to find the older adults category page. And then this, like I said, is a great starting place and a great little sort of guided search for those who aren't sure what exactly they're looking for and what help or resources are available in the database. Okay, back to the home page to do one quick sample search. So using the keyword search, and notice that I am logged into my account right now. If I want to search for housing, right, let's say subsidized housing, I can start to type that. You'll get a list of auto-suggested terms. You can select from the list or not. You could type your own term. And then you're going to put in a location. So let's say I'm looking for housing for my elderly parent who, let's do New Haven, who lives in New Haven, and we're looking to move her out of her home and maybe into an apartment. And then we'll click search. And we get our list of results. So we have 48 resources that come back. We can scroll through them using the list or using the pins on the map. And then we can filter down that list of results. So we can filter down based on housing options just for older adults, let's say maybe within 5 miles of where she currently lives, and for age 65 and older. Filter our result set, and we now have 19 resources instead. We can go ahead and add those to a resource list if we have a My2in1 account. So maybe I want to create a new list, resources for mom, and I can create that list. And then I can continue to add additional resources to that list, right? So I'm kind of building up my personalized plan. And maybe I want to search for some additional services. So I might want to search for, transportation as well for her. She might need some help with that. I can search for senior ride programs. I can go ahead, if I find a program that looks good, I can click on more details to view the full resource record, right? To get all the phone, fax numbers, application process, languages offered. I could add this to my list if I wanted as well. I can continue to build up that customized resource list. And then if I saw something that was incorrect with this listing, I could, as a client or as a provider, I could submit a note. So this is a great way for the public to help notify us of things that might be outdated. So we might want to say, program is closed, and you could submit that note. And now the entire 2-in-1 user community sees the updated information that this user has submitted. So it's a really great way to quickly get information out to the 2-in-1 website user community, as well as to our resource department, who will verify this information and then remove the note and make the correction to the record. And then to view your resource list, you just come up here and you can see all of the resource lists that I've built. And I can share this list by email, by text message, or grab a shareable URL to embed in an email, a newsletter, a website, anything like that. Okay, so that's a little bit on how to do a sample search. I'm just going to go back to for a moment to our slideshow. So I want to spend the remaining time highlighting some of the other go-to resources for older adults and individuals with disabilities. There are many, many other excellent community organizations and state agencies working to help these populations. But I could never fit all of those on one slide, so I'm just highlighting a few key partners here, like MyPlaceCT, which is the state's website and information hub for long-term services and supports, and we'll take a look at that a little bit more closely in just a minute. Connecticut State Unit on Aging, who administers many of the critical programs our older adults rely on. They work closely with the Aging Network partners and are really the experts on older adult programs and services. Of course, the Department of Social Services, who has been leading the No Wrong Door efforts and who administers many of the critical payment and basic need programs. The Department of Developmental Services, the Choices Program, and area agencies on aging who provide amazing navigation help and options counseling to so many of our seniors. The Center for Medicare Advocacy, which is a great resource for those dealing with Medicare denials or appeals, and several others there. I also, on the right side of this slide, have listed some helpful online benefit screeners, in addition to the 2-in-1 Navigator I spoke about on our site, as well as some options for in-person assistance, which can be so important. So many folks are not comfortable picking up the phone or going online and really want to be able to sit down face-to-face with somebody and work through this. Okay, and then just a little bit more information on MyPlaceCT. MyPlaceCT.org is the state's go-to information hub for long-term services and supports. So I wanted to just spend a minute reviewing some of the great features and tools and contents on that website. MyPlaceCT has wide-ranging content, resources, and tips to help older adults and individuals with disabilities remain in their homes, as well as a built-in toolkit feature that allows users to quickly and easily save their customized content to their own toolkit that then can be emailed or shared or printed. There is also a partner finder tool that allows individuals to find a trained partner in their local community who can sit down with them and provide information and support, who can provide that in-person, face-to-face touch that I think so many folks need. There's also a specific portal on the site that the certified partners have access to that contains other professional resources and development and training opportunities. So if your organization is not currently a certified partner but is interested in becoming one, there's also a form on the Partner Finder to complete to get more information. There are links to helpful information on the Caring Career site for both individuals looking to hire a caregiver as well as those looking to become one. There's the eligibility pre-screen tool, and 211 provides live phone and chat support as well as assistance with applications for the Community First Choice program. And there's also an integrated search feature on the MyPlace website that pulls resources directly from the 211 database onto that site so that users don't have to leave the MyPlace website and get redirected to 211. They can access all of that information within the same website. Okay, so I'm going to try and quickly wrap up since we're right at time now with a few simple takeaways and action items. So of course, please utilize 211 to find information and resources for individuals seeking help. Use that category page, use the e-library, the keyword search. Use MyPlace CT to get information to plan and manage in-home supports. Find those local community partners that can provide that in-person assistance and to connect to the great information on Caring Careers. Utilize the other go-to resources and state partners to get connected to essential programs. Sign up for our monthly newsletter, Data Glance, that gives a snapshot of new programs added to the database each month. And then here are some links for providers. So if you're a provider and you aren't listed in the 211 database, there's a form you can complete so that we can do an intake with you. And if you are listed in the 211 database, review your listing and submit any changes or updates to our resource department to help us keep the database as up to date as possible. So I want to close by acknowledging that we could not do the work we do at 211 without the support we receive from our tremendous state agency partners like the Department of Social Services and the State Unit on Aging, as well as from the local United Ways. So I am 1 minute over time, so it doesn't look like we have time to answer questions live because I do want to respect everybody's time. But like I said, if you do have questions, please feel free to chat them into the Q&A box, and I will leave that box open for another 5 minutes or so that you can go ahead and chat your questions into that. And then we will provide written responses to all of those questions when we email you all with the copy of the PowerPoint as well as the webinar recording. So thank you so much, everyone, for tuning in today. And please don't hesitate to reach out should you have questions, suggestions, feedback about anything. The only way that we're able to improve the services that we offer, to improve our database, to improve our website, is by hearing from feedback from users like you. So any comments, questions, or feedback, please reach out directly. Thank you so much. Have a great afternoon.